The impact of artificial intelligence across healthcare. Artificial intelligence (AI) is revolutionizing healthcare, offering innovative solutions to enhance patient care, streamline operations, and improve outcomes. From early disease detection and personalized treatment to robotic-assisted surgeries and administrative automation, AI is playing a pivotal role in transforming the medical landscape. This article explores the multifaceted impact of AI on healthcare, its benefits, challenges, and future potential. AI in disease detection and diagnosis. One of the most significant contributions of AI in healthcare is its ability to detect diseases at an early stage. Machine learning algorithms analyze medical images, laboratory results, and patient histories to identify conditions such as cancer, cardiovascular diseases, and neurological disorders. 1. Medical imaging and radiology. AI-powered tools assist radiologists in interpreting X-rays, MRIs, and CT scans with greater accuracy. Deep learning models can detect abnormalities that may be missed by human eyes, leading to earlier and more precise diagnoses. For instance, AI-driven platforms like Google's DeepMind and IBM Watson Health have demonstrated exceptional accuracy in identifying tumors and other critical conditions. 2. Predictive analytics for early diagnosis. AI models analyze vast datasets to identify patterns that indicate the likelihood of diseases developing. Predictive analytics help doctors anticipate conditions like diabetes, Alzheimer's, and heart disease, allowing for preventive measures and early intervention, ultimately improving patient outcomes. Personalized treatment and precision medicine. AI is paving the way for precision medicine, tailoring treatments to individual patients based on their genetic makeup, lifestyle, and medical history. 1. AI-driven drug discovery. Traditional drug discovery is a time-consuming and expensive process. AI accelerates this by analyzing complex biological data to identify potential drug candidates faster and more efficiently. AI-powered platforms such as Atomwise and Benevolent AI use deep learning to predict how new drugs interact with the human body, leading to quicker and safer drug development. 2. Personalized treatment plans. AI helps create personalized treatment regimens by analyzing a patient's genetic profile and predicting how they will respond to different therapies. For example, AI-assisted oncology solutions recommend the most effective cancer treatments based on an individual's tumor characteristics, enhancing survival rates and minimizing side effects. AI in robotic surgeries. Surgical procedures have become more precise and minimally invasive due to AI-powered robotic systems. 1. Robotic-assisted surgeries. AI-driven robotic systems like the Da Vinci surgical system assist surgeons in performing complex procedures with greater precision and stability. These systems enhance dexterity, reduce human error, and lead to faster recovery times for patients. 2. Real-time assistance and decision support. AI-powered tools provide surgeons with real-time data analysis during operations. By integrating AI with augmented reality (AR), surgeons can visualize patient anatomy in detail, improving surgical outcomes and reducing complications. AI in healthcare administration. Beyond direct patient care, AI is streamlining administrative processes in healthcare institutions, improving efficiency and reducing costs. 1. Automating routine tasks. AI automates tasks such as medical coding, billing, and appointment scheduling, allowing healthcare professionals to focus on patient care. Chatbots and virtual assistants help patients with appointment reminders, symptom checks, and basic medical queries, reducing the burden on healthcare staff. 2. AI in electronic health records (EHR). AI-powered EHR systems enhance data management by organizing patient records, detecting errors, and offering predictive insights. These systems improve accessibility, reduce paperwork, and help doctors make informed decisions more efficiently. AI in remote patient monitoring and telemedicine. With the rise of telemedicine, AI is making remote healthcare more effective and accessible. 1. AI-powered wearables. Wearable devices equipped with AI analyze real-time health data, monitoring vital signs such as heart rate, blood pressure, and glucose levels. These devices help detect anomalies and alert patients and doctors to potential health risks, enabling timely intervention. 2. Virtual health assistants. AI-driven chatbots and virtual assistants provide round-the-clock medical advice, helping patients manage chronic conditions and adhere to treatment plans. These tools improve accessibility, especially for those in remote areas with limited healthcare facilities. Benefits of AI in healthcare. 1. Enhanced accuracy and efficiency. AI reduces diagnostic errors and improves the accuracy of medical imaging, ensuring better patient outcomes. AI-driven automation streamlines administrative processes, reducing paperwork and operational inefficiencies. 2. Cost reduction. AI-driven solutions lower healthcare costs by minimizing hospital readmissions, reducing unnecessary tests, and optimizing resource allocation. Predictive analytics also help prevent costly emergency treatments by enabling early intervention. 3. Improved patient experience. AI enhances patient engagement by offering personalized healthcare recommendations and reducing waiting times. AI-driven virtual assistants provide immediate responses, improving accessibility and convenience for patients. 4. Accelerated medical research. AI facilitates faster data analysis and research, leading to quicker drug development and medical advancements. AI-driven simulations help researchers test hypotheses and predict treatment outcomes without the need for extensive clinical trials. Challenges and ethical considerations. 1. Data privacy and security. AI relies on large datasets, raising concerns about patient privacy and data security. Ensuring compliance with regulations such as HIPAA and GDPR is crucial to protect sensitive health information. 2. Bias in AI algorithms. AI models can inherit biases from training data, leading to disparities in healthcare outcomes. Ensuring diverse and unbiased datasets is essential for fair and equitable AI-driven healthcare solutions. 3. Integration with existing systems. Integrating AI into traditional healthcare systems requires significant investment and infrastructure upgrades. Many healthcare facilities face challenges in adopting AI due to compatibility issues and resistance to change. 4. Ethical concerns in decision-making. AI's role in critical medical decisions raises ethical concerns, especially in life and death situations. Ensuring human oversight and developing ethical guidelines are necessary to balance AI-driven decision-making with human judgment. The future of AI in healthcare. The future of AI in healthcare is promising, with continuous advancements expected to revolutionize the industry further. 1. AI and genomic medicine. AI will play a vital role in decoding genetic data, leading to more effective treatments for genetic disorders and hereditary diseases. AI-powered genomic analysis will enable personalized medicine on a larger scale. 2. AI-driven mental health solutions. AI-powered chatbots and virtual therapists will provide mental health support, offering personalized therapy and real-time emotional assistance. These tools will help address the growing demand for mental health services. 3. AI in pandemic preparedness. AI will enhance disease surveillance and outbreak prediction, helping governments and healthcare organizations respond to pandemics more effectively. AI-driven simulations will aid in vaccine development and distribution planning. 4. AI and collaborative robotics. The collaboration between AI and robotics will continue to evolve, with robotic caregivers assisting in elderly care, rehabilitation, and physiotherapy. These AI-powered assistants will improve patient care and support healthcare professionals. Conclusion. Artificial intelligence is transforming healthcare, improving diagnostics, treatment, surgeries, and administration. While AI offers immense benefits, challenges such as data privacy, bias, and ethical concerns must be addressed to ensure responsible AI deployment. As AI continues to evolve, its integration into healthcare will enhance patient care, reduce costs, and drive medical innovation. Embracing AI's potential while addressing its challenges will shape the future of healthcare, making it more efficient, accessible,